Hi. So I just finished doing this case, and I really came out here to talk to you about a problem that I think a lot of men have that are a little bit embarrassed to talk about, and that's gynecomastia. So what gynecomastia is really just a male breast that has a feminine shape, and I see a lot of patients with that, and I think it's something that a lot of men really are a little bit embarrassed to talk about. So I'm just going to give you a little brief overview and some of the things that we do here at Cornerstone Plastic Surgery. So if you look at this gentleman here, I see a lot of this where you see a little bit of a female breast, and then there's the acne that goes along with that. And sometimes that's because of people that take supplements, testosterone supplements or things that help them work out and bulk up, and that may cause a little bit of gynecomastia. But it doesn't always have to be. It doesn't mean there's something wrong, because a lot of men have it, and some studies show about 85% of men may have gynecomastia. It's just too much breast tissue on a male breast. The thing that you need to know, though, is that you can't just get rid of it with liposuction. There are a lot of places that will claim that, but it's not fat, it's actual breast tissue, and that breast tissue that sits right underneath the male nipple needs to be taken out. So you see, through a very small incision here, right around the nipple, I was able to take all that breast tissue out, and you can see how nice and natural that looks. So that breast tissue, see, he's been working out trying to get rid of or hide that breast tissue, but you really can't do it no matter how much you work out. So took all that breast tissue out, and then the breast lays flat. See? And that incision is just skirting inside the nipple, is not visible. So a lot of men are able to have this procedure, go to the beach without being embarrassed, wear tight shirts without being embarrassed. Let me show you another gentleman. Same thing here. So you see here, even though he obviously works out, you see the big traps, he goes to the gym, he still has this sort of feminine shape to his breast. This allows us to take all that breast tissue out, give him a nice flat appearance. So you see here he is before, a little bit of breast tissue, and here he is after. So I just want you to know that the options for this are really simple. It does involve a little bit of surgery. There's no way that you can reduce this away. There's no way that you can exercise it away. It doesn't mean you're sick. It doesn't mean that there's something hormonally wrong. It's a very common thing in men of all ages, from very young to very old. And you need to get that extra breast tissue out, usually through that small incision. Okay? So just give us a call, and we'll take care of you. Thanks.